You're live, Madam Chair.
Hey, welcome, folks. This is House Corrections and Institutions. It is Friday, April 25th. It's around 11:30. We're quickly going to have a discussion on H32 on the section that deals with trying to figure out how we collect data in terms of folks who are reentering the community from an incarcerated setting that is on MOUD, and to make sure they continue that when they reenter into the community, and trying to figure out the data that can be collected and how we can collect it. So we've had Department of Vermont Health Access and DOC talking together. Our legislative counsel, Katie McLean, also reached out to them. So Katie, why don't you come on up if you could? And I know we have Isaac here from DOC, so you can weigh in as well. The testimony that we received from DIVA is that it would be very, very difficult to get this information. The best way to get the information is once the 1115 waiver kicks in for that. And I know the language, I believe, here on page 12 of draft 3.1 is the same. It's the same as what we had.
It hasn't been
It
changed.
hasn't changed. So could you just relay, Katie, what was shared with you? And I don't know if we could do broad language to say when 1115 waiver, and then I don't know.
We also have to, Katie McLean, Office of Legislative Counsel.
It's Friday
I
afternoon.
know. I think there's also, we have to keep in mind the timeline of this bill too, because it's not going to pass this year. So, there is a little bit more time to sort of sort things out before it takes effect on July 1, 2015. So I was emailing with the two departments.
Just to stop you there,
Yeah.
because by passing it out on the floor, passing it out here, past the House, it goes over to the Senate. The Senate won't start work on it until January of next year.
Yes.
And hopefully by January of next year, the 1115 waiver will have begun. So your report could start next year, once that 1115 waiver kicks in.
Mhm.
That's why Katie mentioned it's not going to go into effect this year.
Yeah, and if there's uncertainty about what type of data can be tracked, I think there'll be more information in January. So I communicated with the two departments. The email from DIVA was that there's difficulty to access the requested data. It says, as DIVA testified, this reporting requirement presents a challenge with our current system. We cannot easily connect identifying member information with the population of recently incarcerated individuals. Secondly, they talk about the 1115 waiver. Beginning in January of 26, incarcerated individuals will be able to enroll in Vermont Medicaid 90 days prior to release. This change will allow DIVA much greater visibility into tracking refills and allow us to report this information back to the legislature with significantly fewer administrative technical burdens. Availability of previous reporting. Some work has been done in this area already, including the 2019 to 2022 period. So it seems like you could probably do something fairly generic about having the reporting requirement. Let's see, you would probably want it to, the first report to come January 1 of 27, so you have a full year's worth of data. And if it's broad enough, I mean, if we come back in January and this data just can't be collected, there will be an opportunity for both parties to say it can't be collected or it needs to be fine-tuned, but I would guess that you could probably put something
Broad language.
sort of generic in place.
Folks following this?
Yes.
Is this thing would be willing to have Katie draft up some really broad language? Or maybe some members of the committee could help draft up broad language?
Happy to do that.
Folks want to do that with Mary, Kevin, does that make sense? They would, so what would happen? A person on the 1115 waiver.
Mhm.
The goal is also to get those folks hooked up to Medicaid. before they re-enter. So because they're then hooked up with Medicaid prior to re-entry, DEVA has access to that because DEVA is the one that oversees the Medicaid in the state.
Mhm.
They're the ones that are involved in that. So they could track if that Medicaid is being charged for a prescription refill. That's how I'm interpreting you get the data that the prescription was refilled over time.
You gotta go.
To go.
Yeah.
I'll be back in 5 or 10 minutes.
Thanks,
Okay.
Katie.
We can talk as a committee. So that's the thinking. So Isaac, I don't know if you want to weigh in on this at all?
Yeah, I think that it will be.
Sorry.
Isaac, policy director for DSC, I spoke with my counterparts at DEVA, and we do think that would be a level 15 waiver. We will be able to put it function much more easily because we'll all be within the same system once someone restarts their Medicaid coverage. But I think DEVA just wanted to be, judicious and make sure that we weren't getting over our skis before that's implemented.
Sorry.
So.
That's fine. What's the committee thinking? You want to put in some language like this? Or not? A report back. We have a report back. We're working on getting data. The data, it would be, look at the current language right now. Number of individuals who continue to refill a prescription for MOUD disorder, MOUD, 6 months after re-entering. So right now, DEVA really wouldn't be able to track that because where are you reading from? That is on page 12. About 3.1, it's on the back page. It's a current draft that has been there. So in order to really know if the individuals are refilling a prescription for MOUD, it would be tracking that through Medicaid. The 1115 waiver really helps folks to be enrolled in Medicaid prior to their release.
But the thing is, are we going to be able to get the report? You can redact the names, but are we going to get to see actually something that says this is happening? We often hear there are reports or there's data that we never really see or can confirm, and then it's really not being done, or we don't get the information. So how is that going to be handled, Isaac?
Yeah, I don't want to speak for DEVA, but I imagine it would be relatively simple because you'll have the codes, the unique identifiers to restart someone who's incarcerated as per the 1115 waiver. And then you can just look at their Medicaid history and see if, while they're in the community, 6 months, whatever time period, that there's a claim for MOUD, that they're filling it at the pharmacy. So I think it would all be within the DEVA Medicaid universe.
So it would be the aggregate number. It wouldn't,
Right, we
it
wouldn't be
wouldn't
looking
have
at
individual names,
No, and that's not.
but it would have an identifier number, because if you're enrolled in Medicaid, you have a number. And then they track that number.
Right, that I understand. I'm not looking for that. I'm looking for something that shows we're actually dealing with people's lives going forward and hopefully getting them on a good track. We're helping them to stay on a good track.
Well, part of it, I don't know what else you could quantify except that they are fulfilling their prescription. And I don't know if DOC could do something to figure out if the person has come back into the incarcerative setting within a year of release, but it may not be related to MOUD. That's really true.
Probably query claims from, hub and spoke community health centers looking for if they're seeing, primary care. I think there's probably a lot you can do within the Medicaid space.
Yeah, because if they're seeing a primary care provider, Medicaid is going to pay for that. Tony, we have you, I don't want to put you on the spot, but I'm going to. So if a person is connecting with a hub or a spoke and they're working with a primary care provider in their MOUD treatment, that will be paid for, I'm assuming, by Medicaid. Is that something that can be tracked on that end? And Tony, if you could identify yourself for the record.
Hi, Tony Fallon, Department of Health Division of Substance Use. Yes, what they have been tracking, my understanding from the Blueprint folks who actually track Medicaid prescriptions, and that's how they actually allocate the resources of staffing, both the nurse embedded staffing into programs as well as the clinic counselor staffing, is they do it based upon those claims. So that should be able to be identified and tracked.
So is there a document right now that they can run that would show that?
It shows an allocation of individuals in the state. It would not be specific to anybody in corrections. They run it quarterly that says, here are the number of people in the state of Vermont that receive prescriptions for medications for opioid use disorder. And here is the allocation of, by health service region, those numbers of people. But it's not run currently. It wouldn't cross-reference to corrections.
So then how do we know? That's been my question. I could be there on this bill right now if I had a little bit of correlation, understanding that we were actually doing a good thing. That's where I'm at.
We don't know right now without doing a manual point in time look, but hopefully starting in January, we'll be able to run those reports.
But I hear hopefully often and for years.
Well,
So then that's my follow-up question. You said once January comes. So once the 1115 waiver comes, you guys can get that data that separates it from the general population of people. Okay.
I think theoretically, right? I mean, I can't promise, given what's happening at the federal level, we just lost funding, DOJ's Office of Justice.
yeah, 800 million,
Yeah, nearly. Yeah.
Department of Justice.
So then just again, so maybe we have the right language, we have it ready.
But you gotta
What?
tie it to the 1115 waiver.
But here's
That's
the
what
thing,
you
no,
to
but we
tie
have it ready, but we need that one component and it doesn't start till January of 26. So without sounding harsh, what's the rush? Can we not just wait for that data to start kicking in and then we have the data?
Then you're in
Okay.
session 27.
So
Then you got a
what
brand
would be
new
the
biennium.
difference from what Will is saying is that we have the language in place and we either pass it or don't pass it or wait till then. How much faster will that kick in? Because I can't imagine these folks that are going to be doing much of anything till that waiver's done. They're not going to do anything.
Brian?
It's two questions and they're unintentionally sort of big.
Big or vague?
Big,
Okay.
might be vague too. The first one is, I'm still not clear, and I guess the question is primarily for Mary, but also to any others who want this data and who object to doing it without. What are we defining as success?
I'm hoping folks can go back into the community. And I again can't define what normal is, but to come back, to be welcomed back, to successfully be either on meds that they need for their disorder, opioid drug disorder, can possibly maybe get a job, and also have a living situation. That may not roll out right away. I hope it would. But, we've worked on projects over the years, such as when we wanted to actually work with the general contractors were going to provide training and whatever else for folks in corrections, along with an electrical and a plumbing unit. That actually folks would be leaving corrections with a certificate in hand that they could possibly get a job that is important or is what is being told to them they need to do in order to be, back out in the community. So I'm just trying to have steps in place that this is actually happening for their sake, for ours of that understanding. We can have every person on, telling us this is happening, but is it, and is it successfully happening? And again, successful, that will have very different kind of looks as this goes forward. But I'm probably thinking of maybe the simplest of successes. It just, like I said, possibly they're still kind of following the program they had in corrections, and that they are reuniting either, with family, or they're able to get a living situation or a job situation with that. It's fairly, for me, simple, and that may not sound simple to others, but that's truly where I'm coming from. I could be totally on board for this, but I need, in the years I've been on this committee, every year we hear promises and yes, and we're going to do this and whatever. And these are not just, I'm not saying just DOC, I'm saying from all the different groups, even some of our local agencies that will say, oh, yes, we can support these folks. And then you go to personally talk when someone's having a challenge. And I've had a number of those kinds of calls come to me that what can we do to help this person? I'll call the agency and they don't have the capacity to help them. So then, okay, now what do we do to help them? There's not a lot of options out there. So I guess maybe I'm not being realistic and thinking there is kind of a roadmap for these folks. That's what probably eats at me every day. And I'm saying that sincerely. It's not about being against this. It's about, can we succeed in what we're saying we're going to do?
Well, and so I wholly embrace the definition, and yeah, I mean, maybe it is kind of a simple definition. I like that. I think gathering the information to satisfy that is anything but. I mean, I don't know how we get the data to show that that's happening. Just logically, forgetting,
Well, what would be the roadmap? I mean, the first piece of that, if someone is re-entering, I would think the first piece of that is to fill a prescription. And then to keep track, to make sure they're filling that prescription on a regular basis, whatever. It could be once a month they fill the prescription, it could be whatever. To keep track of that for a year, for that, there's an identifier number for the inmate or the offender that's re-entering. There's a Medicaid identifying number that can be tracked. I don't know what other parts of the roadmap you could do. You wouldn't be able to find out if they held a job because DOC doesn't, I mean, you just don't know.
yeah, I mean, that's exactly the problem that I'm having. And then I think
Yeah.
about someone like Kevin, who doesn't necessarily want folks on this medicine. Would that qualify as success for you if they went out and filled the prescription,
Oversimplified, I'm just looking for some metrics that says that the time and the money that we are authorizing and promoting and expanding is effective.
I totally
Yeah,
want that
without-
too. I totally want
I don't know
that.
how to answer
We
this.
have good outcomes.
Yeah.
So how do you measure that
That's the
outcome?
question. And I don't know, this is one measurement, but frankly, I'd rather know that they're out and they're not on prescriptions and they're productive and they're enjoying life rather than they're continuing on those prescriptions. But I don't know how to do it. I'm just looking for something that says we made the right decision and we should continue or try something different.
Well, I remember, for instance, I had folks had come out of corrections, got jobs, were really doing great. And then, of course, some of the different agencies would have them coming to do their kind of courses or whatever classes or support that they did right in the middle of a workday. So I'm trying to work with, their employer, the agency, can we get this together to actually have this work? We're putting these people at risk of losing a job, which you tell them they have to have. And I guess I'm just tired of these loose ends not connecting, and then we're making it even worse. And then probably actually even encouraging them to go back to other behaviors that probably got them in trouble to begin with.
Yeah.
So I'm just kind of sick of this dog chasing its tail and we never catch it. And I'm sorry you're hearing my passion, but it's been years. Years. I could go back to my 29 years even here, and even before then, the different things I've worked on in my community. And it's like, can we all just pull it together? You know, yeah, I've even asked in our community when we've had different significant issues with not only like the drug issues or crime issues or that, could each agency, whether it's a nonprofit, whether it's a church, whether it's law enforcement, whether it's whomever, that does a piece of the pie in our community. Didn't want a big report. So when I'm talking about a report, something that's simple, that bullet points. Okay, the churches have done this and this that support this many folks or whatever. Just simple to see what we're doing, what we're missing, what we can do better and move forward. That's all where I'm coming from. And maybe I'm not being realistic. But there's got to be something that we can see that will at least have us be able to feel we're taking a more positive step forward.
I appreciate the way you frame that, Marian. It's, it's almost a bigger conversation about, okay, how do we quantify success, right? And I could just think of categories right off the bat, right? Are they dead a year after they get out of prison? If you're alive, I mean, for some of these folks, that's a big achievement. The year after, do you recidivate? Is that the right?
Well, you don't want to get, yeah.
Would we
Yeah. But okay,
would we have that information if they died?
Right.
I mean,
So I'm wondering if we take a step back and look at this, and then with each category, okay, could we get information? Did they pay income tax, which would signify they had a job within the first year out of prison? Not that that's everything, right? But it's something. I don't know if we'll be able to capture it in this paragraph.
This is the whole system.
Maybe it's taking a step back and having a separate bill on data or something to quantify that success you're talking about, Mary.
yeah, I'm not trying to make it hard, but I'm not
No, it
trying to
makes
simplify
sense.
it either, because we can keep going down this path and, keep thinking we're doing something for folks, and we are trying very hard. And I know everyone in here is trying very hard, and the agencies, but we're just not pulling this together to see a lot of the results. I mean, the activities going on in our community have gone through the roof, and some pretty significant stuff going on. Not saying they're from corrections or that, but how do we as communities get our arms around this to do the right thing for people who are struggling?
Question for Isaac. MOUD aside, is there any data collection right now that does sort of an overall quality of life and measure of success, however you want to define it, for recently released? And is there even an attempt to get that information that's self-reported from the formerly incarcerated, and simultaneously from the corrections officers that they still have contact with, POs? Is there any sort of that data currently being collected?
Yeah, it's a good question, and it's a rather complex one. I would have to check with some folks. Obviously, it gets complicated, right? If folks are beyond the custody of the department, and they might have very good reasons for not wanting to give us information,
Right.
or communicate back, or talk to other, PO about certain things. I can ask some of the field folks to see what our touch points are with folks when they're out. I will say though, I think, to Representative's point, or Lisa's point about trying to think about these huge pieces of data, how we can track about it. I mean, I think the department would be fully in support of that, trying to think through how we measure folks' success post-release. I do think, as I've said before in this committee, that the 1115 waiver is going to be a huge step forward for our system. We can't underestimate that. But that there are going to be, and I know S14, which was Senator Sears's bill a couple of years ago, did try to take a step in this direction and look at data collection.
Right.
And I know the crime research group did come kind of a clearinghouse for that. And I don't know if you've had a chance to look through the very lengthy report that they put together on that.
Right. And I was actually thinking of some of the legislation Dick had worked on, thinking that this would possibly help.
But, you know, the data that we do have on this from, you know, granted it's from a couple of years ago, but that we saw 70% of folks who had released had filled a prescription
So
for
you-
MOUD in the community, which is very high for medication adherence.
But, so you haven't done it in a couple of years? So.
How did you get that?
That was a very labor intensive manual chart review with folks.
So you're not gonna-
With routine-
So you're not
That's what
going,
we
you're
reference.
not gonna repeat doing that.
But hopefully with 1115 waiver, we will be able to look longitudinally at folks as they're out in the community.
Follow-up question, is there a national trend on this at all for data collection on the efficacy of incarcerated programs? Longitudinal. upon
Yeah,
release.
I would wager no, that there's very little data collected on this front because you're looking at gaps between jurisdictions, institutions. I mean, we're in the minority of systems, the United States actually prescribe MOUD in particular,
Mhm.
right? Less than half of prisons, you know, a third of jails. I think the committee should be very proud, and I know we talked about this before, about the language around providing MOUD in facilities back in 2018. Recently we just switched to Suboxone.
Yes, I was part of that discussion
Yeah.
as well, and we passed it with, very good thoughts, hopefully going forward. And, even the first year it had some challenging statistics with the cost right through the roof.
Right.
With more people on it than was even ever anticipated based upon the information that was given, that this was what we were dealing with. I just would even someday like us to be somewhat even close to what we're talking about. That's what eats at me all the time, because again, want this to work and want it to work for the right reason. But I'm not sure by at this point passing all this language that we're hoping will do something. But I'm not sure if the dots are going to connect. That's what I'm concerned about. Very concerned.
Yeah, and you know that the health department did create a position to look at incarcerated health, which Julie Scar, the FEDH, and I think there's also a lot of interest from the Advanced Justice Research Center to delve into this and look at the intersection of public health and incarceration. So perhaps that may be one partner to look to on some of this.
Yeah, but what does that even look like? Because we keep putting money towards these studies, but then most of the time come to no fruition or even being used in different ways of moving positively forward. That's my concern. We can have everyone studying everything, but if it doesn't end in more positive results and for folks that we're trying to help, then
Well, I would respond that the last study that this committee did task us with, which was to look at child visitation, expanding that, we did come back with a proposal and we did find base funding for it and we are moving it forward. And I know that bill just passed in the Senate. So I don't think it's all fruitless, but I do hear that point, 100%.
and I'm not trying to make it fruitless. I want to make it so
Nope.
it works.
And.
Hang on, Brian and
Oh,
Kevin.
yeah, not, I apologize.
No, that's fine. Brian?
As far as I can tell, Isaac, this 1115 waiver goes through, we can measure the rate at which people are filling prescriptions once they come out. Is there other, to your mind, important data that we can get from that happening or no?
I think there will be a wealth of data that we can draw on, but I don't want to get too, again, far ahead without understanding quite what it's going to look like and how those claims are going to be collected. Plus, it's not my subject matter expertise, but from working in a health setting with folks on Medicaid, I think there are significant number of data points you will be able to collect and look at, and hopefully working in conjunction with Blueprint, DIVA, and BDH kind of pull that information together.
And then it was sort of a two-parter. The second part is, do you know whether Fox and Crocker have ever done anything with folks post-release? The folks from UVM, Kathy
Oh,
Fox,
okay.
Kathy Crocker.
Yeah,
I know Kathy Fox did do a landmark study on restorative justice practices. Maybe there's more pre-charge, but maybe there's some regarded panels in there.
I'm wondering if they're a possible resource for this data that we all want that nobody can get, which is, well, and to your point, though, our folks post-release going to want to be in touch with them either. I don't know, but maybe that's a way of getting to, do they have a job? What are they up to? Whatever.
I think that's why the University of Vermont was so eager to put together this Justice Research Center,
Yeah.
looking at the, I think, incredible success of the PRIN surveys and building on that. And I think trying to create a whole ecosystem at UVM that's dedicated to that kind of research.
And so I bring this up because I'm concerned, like if we get this report, the 11/15 happens, and we get this report and we wait until 2027 and we say, wow, these people are refilling these prescriptions at 80%, it's amazing. I think for at least half this committee, that doesn't really qualify as success, or it doesn't serve as evidence of it.
Tony has his hand up, and I think it's in response a little bit to what you're talking about, Brian.
Yeah,
Tony?
I was just going to say the study that references the 70% follow-up rates in 45 days was actually done by Abby Crocker and Elias and the folks at UVM. They had done the full research on it. So they have been engaged, and that was a research study requested as part of this committee, I believe it was done for 2022.
See it. Thanks, Tony.
Huh? And Troy? Kevin?
No,
Troy?
I want to slow down here, and I'm not necessarily interested. Most of the committee probably isn't interested in what I would define as success, right? A successful reentry. So I want us to have a definition that defers to the professionals about what constitutes a successful release. We can have our personal opinions as to whether or not 6 months out somebody is still taking Suboxone, but I don't want us to define what is successful. Right now, we have an MOUD operation that is based on best practices. We're tweaking it. I get that. But to your question, what would constitute success? I want somebody else to answer that. I don't think you want me answering that.
No, I would love that.
Yeah.
I said,
Yep. I mean, to your point, you want to ask them?
Well, yeah, is that already defined, Tony?
It's not defined here. I would wonder, and here would be one of the questions I would ask. I wonder if part of thinking through the definition, if we don't use what hospitals use. So I think of a release from corrections in some ways being equivalent to a discharge from a hospital. And hospitals through CMS use a 30-day readmissions rate. So to their mind, if somebody is readmitted to the hospital in less than 30 days, that is a failed discharge. That there is something in that discharge plan that went wrong. Knowing further out that life happens, people's behaviors change, we're re-exposed to elements that are not necessarily indicative of a failed release, as much as it is we've returned to a circumstance that maybe was not ideally healthy for us to begin with. So I would wonder if that is a benchmark to consider, if that thinking that, again, really the goal in this is how do we get folks safely from the correctional centers to an area that shows that we've done that handoff well.
Right.
But that would just be a consideration.
Was somebody else have it? Will, did you agree on that?
I did, but it's not necessarily on the topic. It's more about just the practicality of moving this bill forward.
Go ahead.
Well, just we're having these discussions.
Mhm.
If we vote this bill out hypothetically, let's just say we did it today, it's not going to get moved anywhere until next year. So I don't see what the problem is with us coming back January 7th, 26,
Yeah.
and saying we've spent the summer and the fall on our own individual parts, or if we want to do something as a group, whatever we can do within the parameters that the legislature can set,
Mhm.
that we then come back and take this up without doing it halfway.
Right. Start
Even
it.
if we don't fully have the data behind it, we can at least try and find something that could at least serve as like kind of a placeholder, I guess you could say. And then we get the data and then we make sure that it all kind of ties in. I don't know.
So you're advocating it be one of our first bills, get it through crossover, go to the Senate, get it
I
out.
would say that if, because I'm sure there's gonna be a few other bills
Well,
we'll have over the summer and fall, we could just pop them out in January. Like, we could probably have it by middle. Maybe I'm too optimistic.
I think you're gonna find out next year won't be as gentle as this year,
Oh, really?
but it's a good thought. Brian?
I'm thinking of a ton of airtime, but yeah, does anybody else want to go before me?
No, right,
You got it.
Go for it.
I've been talking lots and lots. So
Not really.
I don't mind I kind of like the framing of, are they readmitted? And so leaving aside for now is it a month, is it a year? What are the populations that we're comparing to determine success? Because I assume folks with an opiate use disorder recidivate or reoffend at a greater rate than those without. And so are we comparing our folks here on MOUD with people in a different state that does not do that sort of program and how often they recidivate? Like, what could you measure? What's the control?
Yeah, it's a good question. I'm trying to think through what it would be as a benchmark, because I agree that there needs to be a benchmark. And the only two things I can think of again are the prescription handoffs and the recidivate, the readmission rate. I think if we consider it to be those individuals that are taking medications, if we cross thinking the person's taking medication, so if they're taking their medicine, therefore we at least theoretically they're not using other substances. They may be, but that kind of I guess I would say it normalizes that population, that it removes opioid use disorder as the primary, hopefully the primary reason why somebody is being readmitted. And then it almost kind of, then you're talking kind of readmission rates against the general population of folks involved in the Department of Corrections.
So folks who are released with a prescription, if they fill it and they don't come back, that's good. If they don't fill it and they do come back, that's sort of evidence that it was working as well. Is that? Yeah.
So where are we, folks? Can we put Katie back up and see if we can move off the dime on this? To at least have some broad language. Intent language, placeholder language, this placeholder term may be new to new members, but quite often in legislation, when we know something has to be put in place first, we put what's called placeholder language, which is basic. It can be our legislative intent or something similar, just to keep the issue alive as it keeps working through. That's what placeholder means. So, Katie, I don't know if you can bail us out of this or not.
I don't know either, but in terms of a few
Hang on.
No, Katie, when Katie wants to speak, I
No,
want to.
no, go ahead.
Is it possible, because of the time frame at this time, that if DOC believes, and I know there's others that believe this is the right path to go, that they need to tell us how they can measure their proposal as a success? Why should we be telling them that? So for next session, if they come in and they still feel this is the right way to continue and expand, they should be able to give us some metrics that tell us that they're right. Anytime you make a financial or a social or any kind of a significant decision like this, there should be rationale that you can say, this is why I'm recommending this policy. Is that not a reasonable suggestion at this point in session, to have them rationalize why they know this is the best path to go? Because in my mind, and you've heard it a million times, the optimum would be for everybody to get off of all the drugs, including heart medicine, diabetes, etc. Now, everybody can't. I go with that. But if that's the measurement, then we should have some kind of measurement towards that success.
Like
I don't know how to get there, but the proposal of the solution should have rationale for why they believe that's the best way to go.
I love trying to identify, and it goes back to Troy's question from a while ago about, what is success and who gets to define it. In terms of who gets to define it, is it DOC? Is it a doc? Is it a social worker? And that's a true question.
Well, and Dr. Loudon, is it Dr. Lord? Part of his success would be, like, I'm in AA for 20 years, I continue to get help to stay off of alcohol. If they're working with a doctor and they're continuing to be productive and not suicidal and they're not hurting anyone, and they're still on Suboxone, that would be a measure of success, in my opinion, because there are long-term effects on the body to continue on Suboxone. You'd be better off to do all of that without the Suboxone.
Well, so the question is, you named DOC as sort of like owning the definition of success. Is that what you would prefer to it? It's a question.
The proposal of whoever is proposing it should be able to say, here are the metrics that tell me that this is the best way to go.
Yeah,
TLC but TLC doesn't get involved with people's lives so much in
Yeah,
the
I hear
community.
you.
Their focus is more within those walls where they work with the person 24/7. Once they re-enter, they still are sort of under the supervision of TLC if they're on furlough or parole, but they're not doing the minutia of their day-to-day life, and they've got conditions to their release. They're hoping they're successful. They abide by those conditions of release. If they abide by those conditions of release, they're successful.
Yep.
If they stay on Suboxone and they refill their prescription, they're successful. I mean, that's what you see. I mean, you can't, it's really hard to legislate into, are they working? Are they keeping up with their rent? Are they meeting their doctor on a regular basis? You can't legislate that. That's life out there, but you got to figure out what you can measure. If you can measure, yeah, I'm filling out that prescription I'm supposed to be on, and I've been doing it for a year. Is that success?
Yeah, but everyone was using the 70% success rate based upon something that was done several years ago.
But we're talking about, let's update this. That's what we're
I
talking.
can understand that. I do understand it, but
One of the things that I think may need to be reconciled is a lot of the data that we look at is old. So if I think of like the Vermont social autopsy data, we're evaluating data from 2021 to say, are those folks that were released from corrections still alive? Have we reduced their risk of death? And there is a data lag to that. So
Well, who has
reconciling.
Tony, who has that data? It's not DOC. Who
No,
has
that
that?
actually, that goes, it's a multitude of folks throughout AHS. It gets published through the health department, but it is data that is consolidated by all of the AHS departments looking at, for those individuals who experienced a fatal overdose, can we do a social autopsy? Were they involved in corrections, and how long before? Were they involved with EMS? Did they have Medicaid? Did they see physicians recently? What is to try to gain an understanding of the profiles of the folks that we know that we are losing in this state, to be able to kind of move our services to understand who are the folks that are high risk, but those have a significant data lag. Because by the time you pull all that information on people for, 22, the folks who passed away in 2022, we'd be doing that this year by the time you get all of the EMS data, the Medicaid data, the health department data, the correctional data, and pull everything together and then say, did those folks survive? And with those who didn't, what is the profile of those individuals?
So could you do two things? Work on that, ask for that data that Tony just talked about, knowing there's a lag, and also have the data from the prescription refill. And that's what would need to be in a report. And we know there'd be a lag.
How long has that been in?
MOUD's been in place since 17, 18.
So we got a lot of data.
Well, you may, but it hasn't been collected.
Exactly. But 2017 to.
But it depends how you're going to assimilate that data, because you don't have
Right.
the ID number for Medicaid, DIVA, to follow that at this point. They would have it once the 1115 waiver is put in place. But up to this point, a person that's reentering a community from the incarcerated setting, sometimes there's 2 months lag before they hook into Medicaid.
Right.
But I go back to Dr. Lord's testimony that he gave, that since we have put in place MOUD in our correctional facility, what he has seen on the outside, because he's been in this business for 25 years, what he has seen is a drastic decrease in folks who are coming out of an incarcerated setting, overdosing and dying. That's a success, that when they're coming out, they're not going on the street to get high, going into an overdose, and then in some cases dying. And that was part of the intent of doing MOUD in our correctional facility. And that was also work that was done upstairs in Human Services Committee for at least 2 or 3 years to put in place on the outside a system to help folks who re-enter from an incarcerated setting so that they don't do that shot of opioids to get high and then overdose. So the MOUD program within the incarcerated setting is being successful in that people are not dying and overdosing when they re-enter the community. That was a measure.
And we did work on that a lot upstairs where it came from.
So we can blame you on it.
Yeah, right, blame James.
No, I'm saying you should move forward, do what you want, and I'll have to, when we get to a vote, just decide at that time. But I'm just, as I said, for years, have just continued to hear the different things that are being done with no measurable, and again, I don't want it so complicated that you'll never get even, and thank you, Tony, for explaining that. You'd be getting it for all these entities, people dying, this, that. You can't even get simple information, let alone all this, other information. They're never going to correlate it. So I don't know if there, is such a 1 or 2 things that could be looked at easily and simply, but probably not. So I think the committee should move on with the discussion and what the majority of the committee is looking to do. And hopefully I can be there, but I'm not sure if I can.
Connor?
I think it's a good discussion because we sort of have to define what success is, right? And we may have different ideas of what that is. I'm just Googling, which is totally irresponsible probably,
Right.
but looking for key metrics and research-backed indicators for what measures success in these MOUD programs. And just going through the list, reduce risk of overdose and death after release. That's, a big one.
That's a biggie.
Increased retention in treatment. So if you look at Rhode Island,
Because
There's-
they have an MOUD.
yeah, so
program.
their program showed that individuals given an MOUD in prisons were more than twice as likely to be in treatment 30 days after post-release. To me, that's a good indicator. Lower rates of recidivism, obviously.
What did they base it on? They're likely. Do they have anything that actually showed?
I think it could be maybe if we enlisted NCSL, we don't have to reinvent the wheel necessarily. If other states are using some metrics here, reduction in drug use and relapse, improved employment and housing outcomes, then you can get a bit callous cost savings to the state, right? Because they do have data on that in some of these other states. So I don't know if it's worth a call down to NCSL. Sometimes they have spreadsheets like this that go state by state.
So do we want to put any language in that asks for and I'm just putting stuff out on the table, I'm not tied to anything. To put language in that we would tie a report back to how many prescriptions have been refilled over a period of time, prescriptions were refilled over a period of time. Knowing that the data won't start to be collected until the 1115 waiver kicks in, which is January of next year. They could start collecting that. If they know we have some language in a bill that, we're doing this, you got to start collecting it, even though the bill is not law yet. They know that it's out there. We know it's out there. At least for the prescription refill piece. But then there's also work that would need to be done. And I don't know how this will get done. It's different ways, I think, of approaching it. To look at Rhode Island specifically, how are they measuring these points or NCSL? And correlate and come in with a more defined way of how and what you collect for data. So you kind of a two approach. You do something immediate that we know with the Medicaid ID number, with the 1115 waiver. And then the bigger scope of really researching it and how other states are collecting data. All right.
I'm willing to reach out, and I think there's a tremendous benefit and resource that we have so easily accessible to us with the Justice Research Initiative at UVM. And my answer to your question is yes, I think we can craft language that is kind of a hybrid of a placeholder and starts laying out our intent of what this research would do and the data that we're looking for in broad sense. And then maybe kicking off January with Justice Research Initiative, get Abby in here and talk about, is there anything here that you think you can provide for us? Because my hunch is that there's both an appetite from them and a skill set that they already have that we're wondering where it might be. My guess is that Abby would have good answers for those questions.
I'm open to it, whatever.
And that sounds great. And since Matt has been the process since 2017, I think we ought to look at that data to see if we can see that whatever we want to define as success is we're moving in the right direction. It doesn't sound like we've done that analysis, but that's.
But we also have another entity besides UVN. And besides what Tony talked about within the Agency of Human Services to do the data in terms of the autopsy reports, though that is a 3-year lag, basically. We also have the Crime Research Group that keeps a lot of data in terms of criminal activity. And then we know the 1115 waiver, they can do the ID numbers for folks. So we've got some pieces here. And I'm just wondering to give a lot of people the heads up that in January, even if the bill is over in the Senate, it gives a head start, jump start over there, but it can continue for us in the discussion, but at least we've put DOC and DEVA on notice that at least for the 1115 waiver, you got to, even if it's not law yet, you've got to start collecting that data when the 1115 waiver kicks in January. Because if you wait on that, you're going to lose a whole year. You're going to lose a whole year. And I don't think we want to do that. So trying to figure out language, but that's Katie will work
The
the
1115 waiver is not only for opioid, but it's for all medications, right? It
Well,
allows them to continue the
Well-
medications for heart and diabetes, et cetera.
yeah,
And I'm
Medicaid.
all for that, but it's a continuation of the approach that we've been taking since Matt was put in place that I have the problem.
Right.
So that data is available, and if we look at it, maybe we can see that.
Yeah, the 1115 waiver will help folks, at least when they're ready for transition, will help them be on Medicaid a little bit. And that's true for the whole health.
Right.
The whole health issue. So Katie, did you follow at all what I was kind of thinking, or was I talking in circles?
Yes, I have some thoughts and maybe it's nice just to repeat back what I think I heard. So here's where I think the committee is.
Good, tell
You,
me.
it's sounding like you would like to pass this out this year. And also that you won't have all of the information that you need until the 1115 waiver is in place next January to craft what a report back section might look like. So it sounds like you're interested in putting maybe like a placeholder section in place that says beginning January 1, 2015, or 2025, no, you'd start getting the data back in 27 because you'd need a year of data before you get a report back.
Okay, so it'd be January 27th.
It'd be January 27 that you'd get a report. So you'd say beginning January 27, we'd like an annual report from the 2 departments that's reflecting on whether somebody's still refilling a prescription after X period of time. However, I can also see that there might be an interest or need to ask DEVA and DOC in the interim, maybe by writing a letter, saying, can you come back to us next January and tell us what data is available to collect that might be useful for the purposes of tracking the success in this program? And then you'd have that in January or February. The Senate would get the response too. They would work on it, and inevitably the bill is going to end up back here. And then you have more guidance from the two departments at that time about what they can collect and what is appropriate to be tracking to assess success.
And there's no way for them to have some of those ideas now, so that we're teed up for January.
That would be a letter. That would be a letter we would send to say you're on notice. That when the 1115 waiver kicks in, you start collecting that data. That's what the letter would cover, correct?
You could say that in the letter. I was thinking that would go in the, like, as a placeholder in the statute.
Also that too.
Okay.
You do the placeholder in the statute.
Okay.
You also do a letter coming from our committee that our intent is that when the 1115 waiver kicks in January of 26, you start collecting the data to meet the language in H32 on section blah, blah, blah. And we lay out what the language is there. So they're on notice that come January, they start collecting the data. Even though the bill may not become law, it doesn't become law until July of 26. At least they have those 6 months that they've started to collect the data. So come January of 27, they've got a year's worth of data instead of 4 months or
Okay.
5 months.
Okay.
That's what I'm thinking. Does that make sense to folks, Brian?
I just, Troy's talking about reaching out to UVM, which is great. Connor's looking at, regional examples that might be informative. That's great. Are we being kind of silent on those? And so it's just the 1115 stuff, the local stuff that goes in the bill?
I don't know if it needs language like that, because some of that is done internal, like, I'm not gonna put you on this, tell you you're gonna do this, Katie, but sometimes when we're looking at legislation that's being drafted, can we reach out to other states and see what they're doing? Sometimes legislators off session say, I'm really interested in an issue, I want to do a little bit more work on this. Maybe that's something, and I'm not putting Troy on the spot, but maybe Troy would want to work on this off session with UVM and then come back. It's not something, or you could put that language in the placeholder language.
It just felt like the data points that Connor was talking about from his Googling over there were more like what Mary was looking for. And the stuff that we're talking about putting in the bill is more like, it's a little bit crass and flippant, but like the proverbial drunk who's looking for his keys under the light because that's the only place he can see, Like these are the data points available to us. Yeah.
Do we need legislation for DOC to work with whatever data they do have to come back in January and say, here's why we still believe this is the right direction to go?
Well, that I think you would do more in terms of a letter of intent.
I think you'd want something somewhere because they'll say at times, I'm not saying, I'm trying to say this is a negative, but they'll say they'll do something and then we don't get it.
That's why you do it both with language as a placeholder, but you can send a letter of intent. Does that make sense for folks, for Katie to do some of that work? Because I don't want to send her away to do work that we're not going to end up thinking is a good thing. Where are we, folks?
I feel good about the direction.
I do too.
Other folks?
I'm gonna initiate outreach to Abby Crocker.
Other folks? Sean, Kevin, Joe, Mary?
I'd have to see, obviously the language, we're not trying to have you feel like you're going to have to write this 30 times. Because again, like I said, I'm good with what's written and going forward and having something out there. But as I said, I'll just have to see it at the end. I think that's a good direction to start.
I
agree.
Have Becky. That goes back.
I'll volunteer to do some NCSL research too in the meantime if Troy wants to tackle the local stuff.
So the other two, you're okay with Katie doing some work, drafting up some language?
So I suppose.
Yeah, I don't want to work, Katie. For me to be a yes on this bill, is that what you're committing me to?
I'm not committing you to
Oh, no.
being a yes. I'm
Okay,
committing, is it worth her time to do the work on the bill? For that work.
Yes. Yes.
AKA, does it have a potential to move?
So Katie, why don't you spend some time and we'll see you on Tuesday? It's Friday. It's Friday.
It's Friday, and it's Maple Festival weekend.
Yes.
About that.
Oh.
So work with Phil, see when your schedule is. Yes. Sounds good. Thank you, Katie.
Thank you so much.
Yeah, no problem.
Have a good day.
So we have, I know it's late, I know it's Friday, I know it's 25 after 12, and we're gonna get out of here. We're not working this afternoon, but Scott is here with the spreadsheet, what the Senate did on the Capitol bill.
I'll give you one thing that we were talking about this the other day. The monument did pass its elevator.
Inspection?
It did. And that came from, the gentleman, why can't I say his name, from the fire department that they do all of that.
Not DeRosa.
No, but it's the one that does it. It did pass and that came through. yes.
What a relief, huh?
And I don't know if you need a formal thing on that, but it did come through.
Can I give a quick security update there? That's
Oh, yeah, with
Yeah.
Wanda and
just,
VSC.
I haven't even I spoke to Kevin a little bit, but, yes, Steve Howard is, willing to come to the table to talk about a survey. The commissioner
For security and.
for security in state buildings. The commissioner is also willing to do it. They don't really want the department being the driving force on this. But I said, like, it would be really helpful if we had the department in as VSEA is developing a survey, so everybody can sort of agree on the metrics and make sure the questions aren't leading, so that the data we get back next year would all be in sync there.
Yeah.
So Kevin and I have to sit down with the two of them to try to hash something out. I also kind of did something unauthorized off Kevin's idea there. The chair mentioned it too. I reached out to a vendor that works mostly with like big university campuses, but there is stuff like you were saying, Kevin, like apps on your cell phone. And it's pretty interesting. You push a button and hold it as you'd be walking to your car. And it's if you release that button, right?
It's a nerve.
It would go back to a central place and would have your GPS there, only for employees who wanted to do this.
That makes sense.
But I signed up for like a tutorial to come back immediately because they probably were envisioning a
Lot of money.
millions and millions state contract or something. But I'll do a little digging on that too because I thought that was an interesting
It's
idea.
a great idea.
It's only effective to give the employees comfort if there's going to be someone there to pick it up right away.
Yeah, and it was interesting. I was looking at the videos of it. You just release and it starts beeping and
Yeah, that works.
How do you stop using it? If you.
Yeah.
I gotta do the tutorial still. Yeah. I didn't get to that part of the video, Troy.
You can lift your thumb up and you're like, no, not real.
The question is, who's there to receive the beat? Because they talked
Yep.
about some of the buildings didn't have anyone. for
Right.
security.
Right. So
I'm sorry, I don't mean to always take it the next step, but those are the pieces I like
Right.
to have.
It does no good if there isn't someone to be able to respond now that has the ability to.
I'll do some digging on it. Maybe it'd be good, like if you fall in the shower or something too, you can tell BTO security.
That's right.
Okay,
Neutralize the event.
so we have a spreadsheet. Do people want the spreadsheet before we go?
Yeah.
Okay.
Yeah.
Love spread.
No, actually,
Before I forget, we also we're getting language from House Judiciary on S-109 that pertains to fine, and it pertains to earn time for 90-day notice for the victims. I don't want to forget that. And if we get some language today, I hope. But maybe you could connect with Nate and find out where it is, because once we get that language, we're gonna have to do some work, particularly on the Vine language. Jennifer Pullman already presented the 90-day thing for earn time. Okay, here we go, folks. The spreadsheet looks really different.
and also.
Don't freak out.
Your calendar today, the language.
We only have to go from set to nine today.
Language for what?
You changed it.
I don't know.
Yeah, they did. And then, well, do you know the bill went to approach?
Capital bill?
Yeah,
I didn't see the Senate floor this morning, Madam Chair.
What happens to be the wrong with the wall I did?
I did not know this.
Alexa, is that one?
oh, this.
Yeah, I just told him to get back here too.
Good luck.
Well, no, Will.
Same information.
Good luck.
Oh, hang on to your hats, folks. It looks a little different, but that's all right.
So the red.
I vote not to concur.
Yeah,
Red green means before Christmas, is that what you're trying to tell us?
now it's the rug.
That's how you're
It's the rugs. Our rug is red and their rug is green.
Thank you, Madam Chair. For the record, Scott Moore, joint fiscal. That's exactly what happened here. We have 3 sections now. We have the gray, which is the governor, because governor starts with G and gray starts with G. So I got. Then we have the burgundy.
audience.
I know, I could think of another word.
Then we have the burgundy, which is for the House, and the green for the Senate. So this was voted out of the Senate institutions yesterday afternoon. My understanding is it would probably go to institutions on the Senate floor this morning. I don't have that officially knowing that because I didn't have a chance to watch the Senate floor. So
I mean, go to approach.
go to appropriations.
Go to approach.
So this is not as passed by the Senate yet. This is still just as recommended by the Senate Committee on Institutions. So if you like, Madam Chair, I can start at the top and work our way down. And I'll try to be quick, recognizing y'all want to get out of here because it's Friday. So basically line 4, the statewide 3-acre parcel stormwater, the Senate reduced the $1,100,000 FY27 bonded down to $850,000. And I can talk a little bit more about as to how some of the math worked out, but just to get through this a little bit. The next line, we see the Pittsford Academy firing range upgrade. Again, in FY27, the bonded dollars has been reduced by $200,000. And
Zeroed it out.
zeroed it out, correct. Then the last item, line 15, the 32 Cherry Street parking, they halved it. So from $500,000 in FY27 bonded to $250,000 in FY27 bonded in the Senate version. There were no changes made to section 3. Section 4, we'll see lines 33, 34, and 35. The 3 Bs they added back in. This is back in cash, whereas the GovRec had been in bonded, but this is now added in as cash. Then on line 37, the Bennington Battle Monument, they reduced the House recommendation by $100,000. That would be FY26 bonded. And there are 2 new things that were added in here. One is the Champlain Valley Regional Planning Commission, thank you. A study on the multi-parcel use in downtown Montpelier, essentially the post office, the parking lot, that whole area there. A study as to what to do with that.
I promise I didn't lobby for this to be in the capital bill, just so.
I know that.
I think the research needs to be done.
They added.
Explain where this
Wanna
comes
be-
from, because it's not a capital bill.
This one and the next one, which is to the Department of Housing and Community Development, a grant for recovery residents purchase. So those 2 things, the $100,000 in FY26 cash and the $250,000 in FY26 cash, those 2 things were items that came to institutions on the Senate from the Senate Appropriations Committee.
So those 2 items, the parcel use study and the recovery resident purchase, the grant, those would have been or had been in the big bill.
Correct.
So can you say what cash went between Senate appropes and Senate institutions?
If
Or do you want to wait on that?
it might be easier to wait, and then we can come back and I can show you how all the math works. But
So these 2 projects would have been, and were they in the House version of the bill?
I do not know, Madam.
I did lobby for the Montpelier project to go in the appropriations bill. And there was some discussion on the appropriations side. I know the Senate appropriations. Yeah. Here, and then they needed more information, it waited, and then Senate appropriations put it in. So but I don't know how it got here.
Yeah.
Apparently
And
get some
and the
power.
same thing with the Department of Health Community Development Grant for Recovery Residents purchases, that was
Department of Housing and Community Development.
Is there a
DHC.
site for that they're targeting?
oh, Department of Housing, right?
Yep. I believe there was talk about a place up in St. Albans. I vaguely remember something about that, but don't quote me on that.
That was in the big bill.
It was in the big bill. Yeah,
We don't know if that was in the big bill on the House section.
don't know.
Only what I discovered in the last 90 seconds here.
No, opposed, I'm just curious.
I
That would have been in the. big-
no, I don't, they news to me.
Section 5. The Senate took a number of the building communities grants that the House had raised to 300,000 and dropped them back to the gov rec. So essentially, we're back to what the governor rec had been, minus 50,000. But you can see they basically took $50,000 from everything except for the agriculture fair and field days, leaving that at 300. And that is only an FY26 bonded. They left FY27 at the House recommendation of $300,000 across the board.
So that says to me they were looking for money. Oh,
They
were looking for money.
Sections 6 and 7 stayed the same, as well as section 8. Section 9, there are two items here. Again, the Forest Park and Recs item on line 79 for fire apparatus for $275,000 in cash. That again was something that the Senate Appropriations had asked Senate institutions to put into the capital bill. So again, that would have been something from the big bill, put it into the capital bill.
And do you know what fire apparatus means?
My understanding is it would be the purchase of a fire truck, but I don't know if it was a tanker or a hook and ladder or what kind of thing.
We're never purchasing a fire truck.
It's for the Big E.
Yeah, right. No, it isn't.
This guy get
We tried to purchase a fire truck for the police academy.
That's what that should be called.
The what? Fork? Yeah, no kidding.
Then we have the Fish and Wildlife, the Lake Champlain Walleye Association,
Fork,
Never
fork,
heard of
fork.
that before.
5,000,
fish.
again, just in FY26. The other
Didn't
one.
stop.
Section 10 and 11 are all the same. Section 12, there is the Veterans Home Incubator Farm. It is not an incubator farm. It would be located at the Veterans Home, but it is not a Veterans Home program.
So this did not come from the Senate Appropriations.
No, this is something that the Senate Institutions Committee had added in here.
And it comes from the Conservation District.
Correct, yes.
Yes, they were told when they presented this to the community that they would raise the funds for the project.
And they came in, the conservation districts came in a few years ago here wanting us to open up the capital bill to them to purchase a tractor and to do something with buildings. And we
Why is
said,
Ag doing this?
well, and we said, wait a minute, I don't know how many conservation districts are out there, 12?
About
And if you open something up for one,
Same thing.
if you open something up for one, they're gonna be knocking on the door.
down to the judiciary, the total dollar amount on line 124 stays the same at 8 million. It's just 1.1 million has been shifted from the cash over into the bonded.
Looks like they were looking for cash somewhere.
So does that? Okay.
Commissioner
So they
Manoli,
still get the 8 million, but it's split up between cash and bonded.
Commissioner Manoli said that that's fine. They're used to working with multi-sources. Section 15, the dry hydrant grant program, they added $35,000 in cash in FY26. Otherwise, it was the same. And then I believe that is all the changes. Section 16 stayed the same. 17 was our reallocations. That would stay the same. And then we get to the last page, Madam Chair, I can show you what you were talking about earlier.
Just say, oh, there it is.
If we look kind of in the gray columns where the GovRec was the cash fund, we get that 4% less debt services. Would be 14.8. We had a discussion in this committee about only accepting 7.5 with the other money going to appropriations, if you will. That earmark for 2 million for the 3Bs. And what the Senate construct is to keep that 2 million back here in the capital bill, plus other monies, some of which would go to some projects, as we've talked about, for appropriations. I believe the total number is 273,
Yeah.
something like that. So it's a total of $2.7 million more of that $14 million cash, and 2.7 more than what we had done here in the House.
Of that 2.7, my understanding was 2 million was the 2 million we gave approach for the 3Bs.
It's correct.
So they're giving that back, 2 million. Senator Probst said, we'll give you back that 2 million that we gave them for the 3Bs.
Right.
And we're also going to give you 700,000, but this is where we want the 700,000 and the projects like the Central Vermont study, the Department of Housing and Community Development, Recovery Residency, and the fire apparatus.
Right.
That is
And that 700,000,
620.
they're giving back, but if they weren't giving it back,
earmarked.
that 700,000 would stay in the general fund.
Correct. Yes.
So it's a way of getting that cash amount for the Senate to feel more comfortable that they're using more cash.
And then the other 105,000, give or take, went to the walleyes, the dry hydrants, and veterans home. My apologies, not to the veterans home, but to the incubator farm located at the veterans home.
That's how they use the 100 and some odd thousand that was left.
The 35 on the dry hydrants, wasn't that the salary?
Yup.
Yeah. Okay.
So we'll have an
opportunity. Oh, sorry, Ken.
The governor recommended roughly 17 million cash total.
Yes and no. My apologies for interrupting.
No.
The 14.8, yes, but there was interest in prior year's balance. So part of that 17 million is interest from last year and last year's balance. So they really only recommended the 14.8.
And that's fine. My question is what is the impact overall for us only using 14 million or 11 million versus his recommendation of 17 million?
When we look at using cash versus bonded, if you use less bonded dollars, you would end up paying less interest. There's less bond servicing. Cash sometimes is harder to track, if you will, in terms of when we have the bonded, we have a reallocation committee that goes and looks at some things like that. Ultimately, if you remember, Nick Kramer had come in and said, for the purposes of the governor, bonded versus cash, the source, the money's the money. They treat them both the same. But when we look at the long-term impacts, the biggest thing would be debt servicing and having less debt.
Well, it also pulls cash out of the big bill, out of the general fund. So
we're not pulling as much out of the big bill. If we go with the
we
Senate.
decided, right. The
They're
governor wanted us to pull out 14 million this year.
Yeah.
We said we'll pull out 7.5. The Senate is bringing that to 10.
So the other,
Well, really, you got to take away you got to take away 700,000.
Yeah.
Because it's only 2 million. They gave back really 2 million, the 2 million we gave for the 3Bs. So
We're gonna have opportunity to discuss each of these changes next week.
Conference committee.
So we only speak about them holistically.
Holistically, in terms of, do we agree with these changes? Do we concur with the Senate proposal of amendment?
Overall.
Do we not concur with the Senate proposal of amendment and try to concur with further amendment? Which means the two committees would go back and forth up and down the hallways trying to figure out what changes are made, which is going to be really complicated this year. You not concur with the Senate proposal of amendment and appoint a conference committee to negotiate the differences.
So well, it's good to discuss for a few minutes.
Yeah, we can discuss, but you don't get into testimony per se.
It's okay.
for that? You can. I'd like to have the walleyes come in, number one. I think that's important.
I mean, I guess I feel badly that I'm not gonna be able to discuss the washers and dryers.
They didn't change anything.
I know, but I was hoping they would, so.
What are you talking about? But they didn't. Time.
Just real quick, one of the, still not, one of the reasons I'm sure you already know this, is you don't want to talk too detailed, because if the conference committee goes, then they already know everything we're thinking.
You gotta be quiet.
They have the leverage set, because we just told them, gave them a shot on my hand.
You gotta be,
Anyway, sorry, Mary, I didn't mean to go.
No, I think, I was just trying to say, Joe was wondering how we got to a vote of either go to conference or whatever, without knowing kind of a little bit of the details of why they switched. Yeah, but you don't take testimony, because like they said, you've got to kind of go into this with your eyes opened and
Yeah, fair enough. So,
they not knowing your hand, and I'm sure if anyone was.
And Madam Chair, just to remind the committee, this is gonna go to appropriations. They might make changes. I wanted to give you as close to real time as I could.
Thank you.
I mean, the big thing is there's 2.7 million of general fund dollars that came in. 2 million of that was our 2 million. We gave to approach to do the 3 Bs. So Senate approach says, okay, you can have that 2 million back for the 3 Bs, okay? But we're also gonna give you 700,000 on top of that, but we want that 700,000 to go to these particular items to pick it up in the capital bill instead of the big budget. That's all it is.
And do we know why?
I don't know why. That would be something to ask in conference committee. And then, right, and then what the Senate did, instead of doing the 2 million for the 3 Bs, they went back to the governor's recommend of 3.1 million. For that, with no language. Governor's recommend, so they had to find $1 million.
The Senate calendar today has the Senate institutions information in it as well.
What time is that? 1:30?
No, I'm saying it's
Oh.
just, they've got the information in the Senate calendar too.
And they did not do a strike law. They did an amendment, which sometimes is more confusing to follow.
The only other thing, Madam Chair, and I will let John come in and explain it. But when it comes to the back part after section 19 of all this, there's the language policy stuff. They left everything the same. They added one policy piece, one other extra section, which was for JFO to be required to give them a report on the cash fund and how the cash fund works. Other than that, everything else was the same. I don't want to speak too much to that because it is language that's John's world, not my world. But just to give you an idea, they didn't change anything else from the language you proposed. They just added one thing.
Sure, they did the easy part, and you worked on the language.
I don't think they even did the language. Did they look at the language?
John did go through it with them.
And there were no questions?
John went through it with them. I had to,
I don't know.
sometimes he was there when I wasn't, but.
So this is helpful, Scott. Thank you.
Thank you, Scott.
Thanks
We're
for
taking-
our weekend.
We're taking the next step in our capital build process. There'll be many steps here. And we're still tied to the appropriation because the House version had the Bs in their version. So that's gonna have to be referenced. So the House and Senate conferees for appropriations bill will probably be appointed towards the middle to the end of next week, I would say. Because the Probes bill in the Senate will probably be up on Tuesday.
Calendar math, Madam Chair, as you mentioned, that makes sense.
And then it depends if they suspend the rules to get it over here. If they suspend the rules to get it over here, they'd be here on Wednesday. And then if we suspend the rules to take it up, then they get into conference. And conference for them will probably last about a week.
Yep. I think, Madam Chair, we did like 3 days last year. I don't remember, but I think.
Once the budget gets going. German is on the way. But it's gonna be the education bill. It's gonna really be more than the budget's gonna get done before the education bill.
June 21st.
No. But usually what happens, when the budget's done, we adjourn. But that's not the case this time because of the education. bill. So our two bills, our two budgets are still intertwined. Since committee members,
So we're gonna stay,
we stay,
what I thought I heard you say is that this year, because of the education bill, we will be extending the session.
we won't adjourn until we have an ed bill.
Right.
So we're not, usually we adjourn when the budget is done and everything else we make sure gets done.
Yep.
And then the last bill we work on, on the day of adjournment or the night of adjournment, is the state budget. And we have everything else done. This time around, it's not gonna work that way because there's so much more work that needs to happen on the education bill than the appropriations bill.
Right.
So we'll get the appropriations bill done. We're not gonna leave it hanging out there because that gets real crazy if you do that. So that will get taken care of while the education bill is still working. But there's still gonna have to be connected because you're dealing with a finance piece where you're dealing with the 77 million for property tax buy down rate. So there's a connection there too. So that will have to get resolved. So it's gonna be fun.
We're not.
Be a roller coaster. So it's 10 of 1. We're done for the day. We went home with a spreadsheet. Yeah, we will, I think, I would, just because the walleyes is just such a ongoing topic in this world for years, it might be worth to bring in the walleye people for that, so Troy can have a good day.
I would like to hear.
Want to bring back the commissioner as well or not?
Commissioner of Fish and Wildlife, you want to really put that new person on the spot?
Short sleeve. Getting a no from James.
Well, this is my own personal opinion.
I mean, I have her statement from, it was February 20th, maybe, when I was on screen. I don't know if, I don't want to hold her to that if it's changed. Less. I want to bring it up. I asked the question. Right.
These are new folks too, who are,
Yeah, the walleye folks are new too.
they're wildlife folks.
I think we're just essentially following orders. Like, this is how you do it.
This is how you do it, yeah. John?
I mean, does it really matter?
It's the process that there are countless people who would love $50,000 and a direct line to the people who can make it
Direct
happen.
money to them.
Right.
I love.
I see what you
love
mean.
fishing.
I see what you
love
mean.
walleyes. Yeah,
Gotcha.
But they're using Ed Weed Hatchery for this.
yeah, and they're using state facilities to run this program. No, it has not, to my interpretation, been vetted by the commission, by the commissioner.
And how it originally started was they had individual ponds, and I don't know if the people own their own ponds and they raised the walleyes. That's how it originally started.
And we've
20
Because
20
even
plus
now,
years
they're
ago.
being further victimized because they're getting their own testimony.
And I asked Scott to do some data searching for me, and I just want to give you the numbers of how much we've put into this for the years, as far back as what I think Scott started in
03.
25,
I was
2005.
I was able to find data in the capital bills going back to 2003 was the first mention.
So I will
And I
tell
could
you what that
look
number
further,
is.
but that was the archives I had online.
Started.
To date, we have paid $572,000 to the Walleye Association, compounded at 20 years at 4%. That, and it's all been bonded dollars to date. This year is the first year they've used cash. It's $845,000 we've given to this program over the years. If you factor in the interest.
And it's been a handful of people doing it. You know,
I can
private ponds.
list a number of agencies who would have loved $845,000 over the past 20 years too.
And they
And all
know,
they have to do is go to Connor and say, hey, get this in the capital bill. And we all know Connor would do it. So.
Baby.
Man, get that in the budget.
they used to do it for their own, the Walleye Association ponds. It was privately owned per se. It was in their ponds. Now they've converted over into tanks. And I forgot how many tanks. They said they have 15, 16 maybe, and they're all at Ed Weed Hatchery. So it's really Fish and Wildlife should be doing this.
And like,
It's a hatchery cost.
even like for the farm, why isn't agriculture looking at it? Because we had no testimony on this. I can only probably feel that the folks didn't either. So why aren't they going to the departments that should be dealing with them? Instead of.
Well, you better get used to waiting. I love.
Yeah, you better get used to
Kevin?
it.
Kevin, you hear me?
This is all
So you
bargaining.
better get used to waiting.
This is all bargaining. Bargaining. So we'll see.
I will keep the committee apprised when I hear more about passing from appropriations into the Senate floor. And once it's passed out of the Senate, I'll have a final version. Removing the draft watermark, that kind of stuff. If there are any more changes, I don't anticipate there will be, but if there are, I'll make sure you have updated.
So also the chair of Senate institutions will come in next week and present these changes. And that's when we can ask, what's the thinking behind that? Why did you put it in? What testimony did you have? That type of thing. You can ask that.
Great, the same as you had done for them.
Yeah.
They take much less than we do.
Anything else before we break for the weekend and come back next Tuesday? Remember, we have a token session on Monday. You don't have to be here. It moves the calendar back on Tuesday morning. Great. Let's go off of YouTube. Have a good weekend.